Hello all, I'm Dr. Havya, your certified obstetrician and gynecologist with about 10 years of experience in this field. Today I'm going to talk about PCOS. PCOS is nothing but Polycystic Ovarian Syndrome. Yes, that's a long name, but it's a simple condition that has been troubling many girls and women throughout their life. Let's go into deets about what is PCOS. Every month when a girl gets a period, then that finally ends as menses, there is one follicle that matures in the ovary and releases an egg. But in PCOS, this follicle stays immature and it gets embedded inside the ovary, and that causes multiple cysts in the ovary. This is called as PCOS or polycystic ovary. Every woman needs some female hormones like estrogen and progesterone to have their regular menstruation. When these kind of immature follicles are there, this can increase some amount of androgens, that is male hormones in their body. So this increase in male hormones in the body is gonna cause hormonal imbalance. That is when it is gonna be a trouble. What trouble? They may present with irregular periods, they may present with acne, they may present with excessive facial hair called hirsutism, and this is a problem. In PCOS, there is also increase in insulin-like growth factor, which can cause insulin resistance. That is, whatever you're eating, the sugars, everything that you're putting in your body are not being processed well. Where are they going? They're going to get deposited as fat in your body, causing excessive weight gain and obesity. If insulin resistance is not properly addressed, this can lead to long-term complications like diabetes and metabolic syndrome. For someone to have regular periods, ovulation is very, very important. That means releasing the egg in the middle of your cycle will lead to menses every month. In PCOS, this ovulation may not occur in something called as anovulatory cycles. That means egg is not releasing. If the egg is not releasing, it can lead to infertility. How do we diagnose this PCOS? So it is a combination of clinical signs and symptoms, biochemical criteria, and an ultrasound. So if two of these criteria are positive, then we label someone as having PCOS. Nowadays, because the incidence of PCOS has become very high, it has been overdiagnosed, misdiagnosed, and also sometimes underdiagnosed. So a proper evaluation is required. So to make this more clear and understanding, what I mean to say is someone gets an ultrasound done and radiologist says that you have cysts in your ovaries. And I see many people coming that they're worried that their ovary is bad and there are many cysts in the body, what to do and all that. No, just an ultrasound finding of the small cysts in the ovary are not gonna cause any trouble if you're not having any symptoms or if your hormones are in balance. Now that we know how to diagnose PCOS, we should also learn about how to address this PCOS. PCOS, being a lifestyle disorder, is very much preventable. Preventable means that by changing our lifestyle, we can actually control it and may even treat it. So what lifestyle changes are needed to control PCOS? Changing lifestyle starts with eating right. How do we eat right? By decreasing the processed food and junk food and eating healthy, including good amount of proteins, decreasing our carbs and fats, and including lots and lots of fruits and veggies in our every day-to-day diet. Staying active plays an equally important role as controlling your diet. Exercise every day 30 to 45 minutes, playing your favorite sport, doing yoga or going to the gym. Having a good quality sleep and adequate amount of hours of sleep is very important for your brain to recover and release hormones on time. So for this, ideally, sleeping about 6 to 8 hours per day during the night between 10 p.m. to 6 a.m. is mandatory. Even though PCOS can be one of the causes of infertility, about 60 to 80% of women with PCOS conceive naturally on their own if they just maintain the lifestyle changes. Some people, about 30%, may need help from their doctor. By taking some medication, they can make sure that the egg is releasing on time and they can get pregnant on their own. Only rarely, about 1% of people with PCOS can become infertile and need advanced fertility procedures. With the lifestyle modifications, most of them get their regular periods back. If not, the other option that we have is hormonal pills. If you want to know more such informative videos about women's wellness, please follow this channel.